another point of delay. If there is delay in the decision to seek for care, and there is delay in the route through which they will get to the point of care, then eventually when they get to the health facility, time would have been wasted. Then when you get to the facility, the third delay, according to Thaddeus and men, is getting proper care at the health facility. Getting proper care at the health facility. Oftentimes what happens is that, we have this over-reliance on tertiary health facilities. Like this one, Federal Medical Center, teaching hospitals, over-reliance. Then the teaching hospitals, federal medical centers, the tertiary facilities will be overcrowded and busy with cases that could have been managed as secondary health facility, at primary healthcare facility. So when the emergency unit of the hospital where the person is supposed to get care, when the place is crowded, what happens? When the place is short-staffed, what happens? So the person has now arrived at the point where he or she can get proper care, but there is delay because sometimes overcrowding. There can be delay maybe in the payment system. If he or she doesn't have insurance, the payment, there can be delay. Then after making all the necessary procedures and get to the point where the person is being seen, there can also be some delays in the person receiving the care. Now, the initial story was that there was no antivenom. That was pushed, and the government was facing criticism for that. And then the hospital released a statement, said there was antivenom and it gave adequate care. Interestingly, what I think where the mix-up came was the issue of neostigmine. There's a drug that they needed at that FMC, neostigmine. It helps to treat some of the effects of the snake venom. It said that it appears that the patient had neurological issues. So there was a feeling that the snake had neurotoxins that could affect the nerves in the body, and they needed that neostigmine. And that they didn't have enough or so in the hospital. And friends of Naya had to go looking for neostigmine. And when they got the neostigmine came back, as we were coming back, they heard that Naya has passed. So she was at the health facility. She got the antivenom. So it wasn't that they didn't have the antivenom. She got the antivenom, but there was a lot of delay. And then she needed to get other drugs that will help treat what the situation she was in. And the drug she needed was not available, and they had to go and get it. So the person is at the facility, and there is now delay in getting care because what was the part of the treatment she needed was not adequately available. So you now have delay in getting adequate care. So there could be delay at that facility. And now comes the question of healthcare system in Nigeria, where you have over-reliance on tertiary health facilities, and these tertiary health facilities get stretched, and people experience delay in getting care because of overcrowding, of not having enough space and probably not having enough hands to cater for all the cases that are there, you know. And then sometimes there could also be decision making in the facility, in the care that the patient receives. Imagine that there's a heads up. There is, you know, that there's a snake bite victim coming, you know, and there is someone who is particularly experienced in managing snake bite cases, and you needed to communicate with the person. Imagine that you know ahead someone, a case like that was coming, and you see the person, you communicate with the person with the requisite experience and knowledge to treat that situation, and you communicate with the person, and then there's no delay in the person getting all the appropriate attention that the person needs. Imagine that we have like a federal ministry of health, state ministry of health, that look at some of these things. There are particular seasons where some conditions are more common and where certain medications and drugs are more needed. If we are having overcrowding in certain facilities that could delay the handling of certain emergencies, could we have a situation whereby you have more centers being made available and where patient can be guided? Everybody don't have to go to a tertiary institution. You can go to this facility and you can be assured of getting the care that you need. So how can we ensure that, you know, the ministries of health, you know, they are getting certain data about certain conditions. They know the pattern. If people are getting more snake, if there are more cases of snake bite and there is formation, you know, you ensure that you get those things that are needed handily for the care of those patients.